I'm very, very pleased to be here, and even more pleased to see how many of you have gathered today to talk about this very important population, this very important and deserving and in many ways, in most ways, underserved group of young people. You know, it's interesting to hear one's own sort of bio read off in a minute and a half, especially when you've lived as many decades as I have. But I wanted to emphasize one thing that we did, being the first openly gay person in the legislature, and I was there without sort of a backup for a couple of years. It was sort of like the Gay and Lesbian Caucus is now meeting. Kuehl, party of one. And that's sort of what it was like. But the wonderful thing about it were how many allies we had in the straight community, in the assembly, who didn't really know, because they'd never been asked to step up, that they were allies. And some of them told the stories from their families for the first time when I brought the Dignity for All Students bill, which ended up passing after 5 years of trying, which protected LGBTQ youth against discrimination, harassment, and violence in every school in California. But my colleagues got death threats because they were for it. They got recalled because they were for it. Times have changed pretty much in California, but it wasn't that long ago when I was elected in 1994 that it was very difficult. So now, on the Board of Supervisors, and as you heard, my district alone is bigger than some countries, but LA County is 10 million people plus. If it were a state, it would be the 8th largest state in the United States, and it does everything that states do. It runs a health system, physical health, mental health, public health. It's in charge of all of our foster kids in the county. It's in charge of all the juvenile justice or injustice that we do. It has a jail, as you know, and the sheriff and the sheriff's deputies. It runs all the transit. So the Metro Board that's building trains and, you know, buses and highways, trains, is part of the county. We protect the mountains, the beach. The LA River runs through my district, and pretty soon it's going to really look like the LA River. There is an enormous amount that we do. We just put in $100 million for affordable housing, another $100 million to try to find housing for homeless individuals, or as we're now calling them, individuals affected by homelessness. I like that better. But the whole idea behind what we're doing and what you're doing here, in my humble opinion, is change. Change. And whether or not we have the courage and the energy and the unity to really work for change. And there are lots of ways to work for change. Let me tell you a story. A woman was walking down the bank of a river, minding her own business on her way somewhere, and she hears a baby crying out in the middle of the river. Looks upstream, downstream, nobody's there, doesn't know what to do. Finally decides, okay, throws off some clothes, jumps in the river, swims out, brings the baby back to shore. No sooner gets back to the shore than she hears another baby crying in the river. Nothing to do, jump in the river, go save that baby, bring that baby back to shore, and pretty soon she finds that her life has changed because that's what she's doing. And while the first woman is swimming back and forth, bringing babies one at a time back to shore, another woman walks down the side of the river and sees what's going on, throws off some clothes, jumps in the river, swims out. But as the first woman is bringing the babies back to shore, she notices the second woman is not coming back to shore. So she yells out at her, "What are you doing? Don't you see all these babies are drowning?" And the second woman says, "I'm teaching these babies to swim." And while they are both doing that and their lives have changed completely, third woman, apologies to the men in the room, I'm just choosing at random here. Another woman walks down the side of the river, takes a look at what's going on, turns around and starts walking back upstream. And by now, of course, the first two women who are devoting their lives to what they're doing yell after her, "What are you doing? Where are you going? Can't you see these babies are drowning?" And she says, "Yeah, I'm going to go see who's throwing these babies in the river." Now, I tell you the story for two reasons. One is you can use it to start any speech you ever make. Because knowing you, your audience is either going to be doing direct services, education, or policy. And that's really what we're talking about. And when you're an elected official, primarily what you're doing is policy. But what are you doing in terms of policy? What should the county be doing? What should we be asking the county to do, and the state, and the feds, and the cities, and the nonprofits, and the for-profits, and the health system? And that's really why you're here, because you actually work in, volunteer in, or are served by those different kinds of systems. And the LGBTQ community, which was much more disparate than it is now, we are much more unified in understanding about the commonality of our health issues, of our social justice issues. They're not all perfectly aligned because you had some presentation this morning about intersectionality, and that it will always, always be a part of our lives. But the issue of what it means to have a healthy society, I think it's without question, it stems from our society doing its best to make certain that each individual in that society has the best possible shot at being healthy themselves. There is a larger issue of what a healthy society is, but I would suggest that they come together in terms of what we do as a society to make certain that each individual has a shot at being as healthy as possible. Now, we also have to define health, because there is a kind of disparity in our own lives, sometimes in the way we think about health. My physical health, I go one place to get help for that. My mental health, I go possibly to a different kind of practitioner or healing circle or therapist or whatever. Talk to my friends late at night on the phone. Mental health. We think even a lot that our minds and our bodies are somewhat divorced. And then, of course, in many systems, if you want any help with your addiction, that's not considered part of your mental health. And in some systems, not even part of your physical health, though I can tell you, don't ask me how, it certainly does relate to both your mental health and your physical health. So what we are trying to do for LGBTQ youth is, at least in the county, to see if we can't look at ourselves as a unified system in serving a unified young person. A young person who would like to be healthy in every way. If that person is homeless, can they be healthy? We've discovered not, though I think anyone could have told you that years ago. Now suddenly the government's woken up and discovered that in order to be really healthy, you need to not be sleeping on the street. Duh. Now, to make certain that that doesn't happen is a lot more complicated and difficult than simply understanding that issue. Because with 44,000 homeless people on the street right now, potentially, if you counted everybody correctly, 55,000 tonight, many of them youth. With youth coming out of our juvenile camps and institutions, with people barely out of their youth coming out of jail, or the military. Remember how young people are in the military. We have so many people falling into homelessness, not to mention how expensive it is to live in LA County every day. So we've housed 23,000 people in the last 2 years in the county, but double that many have fallen into homelessness. So it's so difficult to keep up. So what are we doing? We're doing what I want to ask you today to do, which is to try to unite your vision, your courage, and your ability to do strategy, policy, program, decision-making, whatever it is, wherever you are, to make certain that one by one, each of our youth, I don't care where they came from or where they are, has the shot to get what they need. One of the things that we've done, people, when they're politicians, they always tout what they've done, and their introduction always tells you everything they did. But you probably know you don't do any of this by yourself. In the legislature, when I brought the Dignity for All Students bill, we had our first Queer Youth Lobby Day. Have any of you ever participated in a Queer Youth Lobby Day in Sacramento? Okay, I see one hand. Okay, I really want to recommend this. It's empowering just to go up. It's scary, but it's empowering just to go up and speak truth to power. And it's a very, very important thing. But it was because of Queer Youth Lobby Day and the young people who came up and spoke to every one of their assembly members that eventually, and barely by the skin of our teeth, we got 41 votes after 5 years of trying to pass a law that put the word sexual orientation in the non-discrimination part of the education code. And we did it for housing. And we started a domestic partner registry with only one thing in it, that you could go visit your dying partner. But that was the nose, of course, in the tent, because the next year we put a couple more things in it. And then finally we put everything that married people had in it. And now we don't need to anymore, because we can get married. But I know you know that was a continuum of courage, a continuum of commitment, a continuum of vision, and frankly, a continuum of just making a lot of noise. So the point here is we have to do what we can where we are. So as a supervisor, I've only been there a little less than a year, but we've done two things that relate to the LGBT community overtly, and several things as part of the larger community. One of the things we did was to bring a motion, and it is the first motion that helps the LGBT community that ever passed in the Board of Supervisors 5-0. Yes, my very conservative colleague from the northern part of the county, Mike Antonovich, voted for it. Why? I think it's the same reason why we invented National Coming Out Day. Because when you know one, you can no longer say, gee, I never met one. It's a little harder to say, gee, I think they're all awful, especially when you're as charming as I am, to quote Mike. So we brought a motion that said, there are a lot of departments in this county, a lot. We have 37 department heads, but we have even more divisions that serve every one of the 10 million people in the county in some way. This motion said, you must explore in your department how you are not serving or are serving or could serve our LGBT youth. And we will hire a consultant to talk to every single one of these departments and help you identify. And the fact of a unanimous vote generally means those departments will take it seriously. Our Department of Children and Family, our department, our probation department. I know we have people here, our Department of Social Services. We just hired a new head of the Office of Child Protection, whose job it will be to try to make certain that all of those departments that serve children in general work together as well as they can. So what will happen, correct me if I'm wrong, anyone from a county department, trust me, they won't. And I don't say that arrogantly, it's just the way things are. That's what leadership is. You say, I've got my miner's hat on, I'm in a big dark tunnel, I've got a headlight on the front of it, wherever the headlight points, that's where we're going. And that's really how it works. So our probation department is aware that many of our children in the juvenile justice system are LGBTQ. 20% of our kids in the foster care system, that's a higher percentage than identify generally in society as LGBTQ. So we know this is an issue for the county. Now the other thing we did, and as the introduction indicated to you, and I do want to give you a little information about it, is we adopted a motion, and that's what counties do. We don't call them laws or legislation. We adopt a motion, and then it becomes county law, essentially. And what we say, because we're the executive branch too, is, okay, now we made the law, now you guys carry it out. That would be our departments. This is about PrEP. So let me give you just a little bit of information, because if I don't, Elon Schultz, my health deputy, will feel dissed having presented these points to me. There are about 60,000 people living with HIV in LA County. So it is one of the largest local epidemics in the country. There are about 1,700 county residents who are newly diagnosed with HIV every year. The minority communities, especially our young minorities, minority women, and transgender persons, are particularly hard hit, and I know you have information about that. We have seen some gradual decline in the numbers annually of new HIV cases, but we still don't have a cure. We still don't have a vaccine. So prevention is really a top priority for the health systems in the county. So one of the most exciting developments in the field of public health in the past couple of years has been the advent of HIV pre-exposure prophylaxis, or PrEP. PrEP is a daily pill taken by people who are HIV negative before they are potentially exposed to HIV. It's been shown to reduce the risk of HIV infection by up to 90% if it is taken consistently. And because patients on PrEP need to be seen by their doctor every 3 months, PrEP also offers a really good opportunity to engage LGBTQ persons at risk for HIV STDs in regular medical care, which is also a very, very important thing. Because often our community tends to sort of avoid. They don't want to answer the questions. They don't want to go to people that don't understand them. They don't want any, as I said, dumb questions. So in LA County, while PrEP is covered by private insurance and Medi-Cal, people who are uninsured or underinsured really don't have any access to PrEP. People who would benefit from it don't always know very much about it. One advocate told our office, people in West Hollywood know about PrEP, but pretty much nobody south of the 10 has ever heard of it. Yeah. So even those with insurance sometimes have trouble finding a provider with enough knowledge and understanding to feel comfortable prescribing PrEP. So in the county, our Department of Public Health is working to increase consumer understanding and knowledge about PrEP. Social marketing campaign, website, posters, postcards, pamphlets, everything that they can do, modern and old school, to increase consumer knowledge about PrEP. DPH is also training, and they have been and they continue to train community provider partners who serve high-risk people to ensure that appropriate clients know about PrEP and, more importantly, know where to access it. The Department of Public Health is also trying to ensure access to quality comprehensive HIV biomedical prevention services in the county in a number of ways. We've created an LA County PrEP provider directory to help link consumers to providers and clinics with experience in prescribing PrEP, training medical providers to increase their capacity, and since October, since last month, DPH has been offering PrEP at 2 public STD clinics that serve high-risk patients. At one of the clinics, the North Hollywood Public Health Center in my district, 3 out of 12 patients referred to the PrEP clinic were diagnosed with acute HIV on their PrEP intake visit, highlighting a high-risk population being served in those settings, some of whom don't even know they're HIV positive. These patients receive navigation services, screening for eligibility for Medi-Cal and Covered California, as well as linkage with a primary care provider. DPH has also released a solicitation for community-based providers to offer safety net PrEP services. The services will be initiated early next year and deployed across the county. So finally, why is it so important? It's been demonstrated to be a truly effective prevention tool when it's used consistently. It's not a panacea, not a silver bullet, has to be used in conjunction with condoms, not as a replacement for condoms. we're required to say that after we passed the motion because a lot of people were very worried that everybody was going to relax about safe sex because now they had PrEP. So let me tell you, it's often good to relax, but not necessarily about this issue. The fact that it needs to be taken daily means it's not going to be appropriate for everyone, but it will be helpful to many. And frankly, as I said in trying to get that motion passed so that we could provide it and do the training, it's really immoral to withhold an effective prevention tool just because it might not be right for every single one of our clients. People said to us, you know, won't it just tempt people, you know, to have sex and feel protected? Well, it wouldn't be the only thing. People often have sex and feel protected when they're not. It's simply another tool. And I say it to you in closing my remarks because there are a lot of areas in which people try to use disinformation to push back against doing the right thing. I know you know. In the larger sense in our communities, if you want some minority group to suffer, the first thing you do is you begin with language. You have a name for them. You talk about what they're really like. You talk about what they really do. I don't care which minority group it is. Before the violence, before the discrimination, before the harassment, there's language. Language that is said to be, oh, you know, just kidding. Or, oh, you know, just something we say at school. And from language comes the rest. Because if it's okay to make someone less than human in the way you characterize them, then it's okay to treat them as less than human. And that's what we've been going through for centuries in this country. I'm an optimist. Now, my definition of an optimist, which I offer to you, is a person who knows how terrible the world can be and therefore is just never disappointed. I'm always saying to people, what'd you expect? Of course they're going to do, of course he's going to say that at a Republican debate. But it really serves me because I don't expect miracles. All I want to do is participate in them. And I think you can too. So the message is, do what you can where you are. Be courageous, be insistent, be respectful, be unified as much as you can, because we have made enormous strides. And I'll tell you, with your help, the county is going to make even more enormous strides. Thank you so much.